you for the invitation. Yes, indeed, I'm also based in New York. It's very nice to see Miodrag again, who I met once a year ago, I think also coincidentally in a conference that he was convening. So it's nice to see that this webinar is also kind of public space where you just bump into people and can exchange thoughts. Of course, I've not prepared anything because I'm about to reflect on what I've seen, but of course I want to rely a bit on a structure of how I see things, and I wanted to maybe explain that together with Gregor and also with Mahak, we are within the International Society of City and Regional Planners, ISOCARP. We are developing a group of knowledge around urban health. And actually we had decided this in March, just 2 weeks before the pandemic became an epidemic. And so of course we are thinking together also a lot about how important urban health is, but of course that COVID-19 is also a kind of lens and accelerator of thinking about it, and that we are very conscious as urban planners that we should much more gear back to the basics also of urban planning, that we are in a way kind of technical discipline that has been made its entry, I think, in, let's say, shaping societies because of epidemics mostly, and that we have to learn from the past, but also see now what is our contribution. And I had written in March a text on Medium, just a kind of venting my own ideas or emotions also being contained in a dense city, and of course also hearing these discourses about density is bad. And I think it's okay to discuss that, but I think what's very dangerous to do, also you hear discussions about cities are bad, and I think that's a useless discussion. I think we can all agree on that, because it's just a fact that people live in cities, and then also our global society and economic system relies on cities, on connectivity, but that we can definitely be critical about this. And I had 5 points, and I want to relate also about what I heard, is that if Mike, for example, says very clearly, like talking about social distancing is a kind of privilege, I think that's true. And I think the confusion also comes from the wording, that I think it's a pity that it's not clearly stated from the beginning from WHO that it's about physical distancing, because it makes it much clearer that that's the issue. And I would also probably accelerate thinking locally that it has to be dealt with differently, and that social connections are very important. I think also what Miodrag showed, what's happening in the Corona neighborhood or Flatbush, it's because of the connections, the social local connections, that actually there is a kind of resilience strategy in place, or there is a resilience structure in place, and that there's a kind of mechanism to cope with it, actually without indeed the governments, and that they are not able to go on that local scale. So I think that's important to, as a lesson learned, to also convince maybe the ones that are not working in physical terminology to also understand that it's about physical space. I think also there has been very clearly now a need of thinking about the public space as a place where you also develop the health system, that it should include the public space as a spatial vaccine. I think that's also very clear that there's very positive evolutions there, that people rediscover the public space as a physical space to be able to respond to the physical distancing, but also as a space where you can somehow have a connection, because a lot of people are indeed in cities housed in low quality housing. And so it's very important to look at, first of all, of course, being very critical about the low housing quality, but also about how maybe the public space can be an alternative. As you said also in the introduction, that density is very important to define it. And I think it's very important to always emphasize about overcrowding, actually. And I think there's good and bad density, but it's especially the overcrowding is an issue, and that we have to focus mostly on those who are overcrowded in housing units or that have to go into transportation units and that are overcrowded. That's a very big reflection and something that also in spatial planning will have its terms. I think it also relates with the fact that I think metropolitan planning will become also very important. It's maybe a technical, it's more a technical part of urban planning, but you see also with the reverse migration that it's very important to start thinking about, to also invest in that a lot. Also from a governance mechanism, I think also New York is a very good example for that, but also a lot of other cities that you know that you have to deal with it on a larger scale that goes beyond the city territorial borders. A fourth thing, what I see very clearly is that the neighborhood scale is so important, that it's actually very important to develop or to improve resilience systems that are really on the neighborhood level and that not exist everywhere yet. And I think it goes across the globe. It's also in, for example, I follow now closely Belgium. It's the same. It's very difficult to see how immediately there's a reflection on the neighborhood level. And it's so important, for example, schools when they close, it's really a tragedy. It's not only about the educational system, it's also about food systems. So you feel like a neighborhood system that can respond is very important. And it's a hybrid system. It's a system that is both, it's a kind of whole system that goes over the life cycle. It's about how do you support children, how do you support their education, how do you support young families, how do you support the elderly. So it's a very important I think lesson learned also. And then finally, also, it has been mentioned also about mental health. I think it's very important that those that are involved into cities design, that we also understand very well that health, that we have a role to play to develop a whole system of health approach, and that the non-communicable diseases, that I think in the health sector, everybody understands that non-communicable diseases cannot be dealt with from a healthcare system approach, and that urban planners, spatial planners play a very important role, and because the space is a determinant of health, and it explains air pollution, it explains obesity. Also, all these diseases exacerbate the impact of COVID as a virus, but also the impact of what's the response. And I agree with, we are all in a shock. I think maybe the advantage that we're all together in a shock, so that we can maybe be much more, that we can be probably much more solid, show solidarity and understand that this is something we have to cope with as a whole society. So that's my reflection.